My hope is everyone can share their love on the chat, but also even one of the most favorite things you take away from those 4 speakers. Again, really appreciate the talks there from everyone. So moving on, we wanted to wrap up today's conversation with a panel discussion, COVID-19's impact on workplace mental health. So I'm going to ask all of our wonderful panelists that you see on the screen there to start coming into the frame here and sharing hopefully your video and your audio. And what I want to start the introduction is with Charles Boyer. He's going to be moderating the discussion and panel. No pressure, Charles. And I'm really looking forward to the conversation. So I will, wait for all of you to join, and we can get started.
Thanks, Rob. Can you see me?
Yes, I can.
Hi, Charles.
Hey, Mario.
Hi, Bill.
Hey, Charles. Hi,
Hey,
Mario.
Bill.
Do you know what you're going to do today, Charles?
It's going to be a fiery debate here, Bill.
Is it?
I hope you're invigorated.
I don't know if I'm invigorated, but do you have the ability to actually facilitate this?
Thanks for the bolt of confidence. That's great. Good start.
I'm not really that confident, but here we go.
Hi, everyone. I'm here too. I just think my video's off. I'm not really sure how to restart it. Shai here. There we go.
Super.
Wonderful. Hi, Shai.
Hi.
Hi, Shai.
Hi.
Okay, Charles, it's your turn to do something.
Rob, am I good to go?
Yeah, the floor is yours.
Okay, I was waiting for that 30-minute bio you were supposed to read, but that's fine. I'll just jump right in. I just want Rob, Bill, Stephen, just thank you. It feels really that you have a community here together. So I thought that was fantastic. And I just want to pick up on the passion speakers and something that resonated with me from each of the speakers that ties into the conversation that we're about to have. Jane, I thought it was incredibly wise that you started by talking about evolving. It's something that resonates with me. I'm evolving as of the conference board. We do in-person conferences, don't have a lot of experience doing this digitally. And my favorite song, Never Be the Same by Tritonal. So evolving. Michael, the unforeseen consequences that is going to come out of this resonates with some of the conversations we had with you, Mario. So we'll pick up on that in a bit. Katrina, thank you for sharing your lived experience. Bill, I think you'll really resonate with Katrina and your lived experience and developing that growth mindset. So something we'll pick up on. And your new book, Stop Hiding and Start Living. And Alicia, the model you showed around safety and psychological safety being at the core of the engine that turns the business of productivity. Shai, something that you've talked a lot about is, what is the most important thing? Is it work or is it well-being? And, something that resonated with me, that's something you said. So just briefly want to introduce our panelists. So Shai MOLEDINA has a deep experience in labor relations and is in charge of the wellness program for Canadian Mortgage Housing Corporation. Mario BARIL, a senior executive within government and has been the Ombudsman for mental health and well-being with ISED since 2018. And Dr. Bill HOWATT, who is a disruptor to this panel and is a chief of research at the conference board, leads a lot of our speaking engagement, applied research. And next week being Mental Health Week, Bill's launching his new book, Stop Hiding, Start Living, which is available at billhowat.com. So incredible to have you all here. Just wanted to get a quick reflection from you all on how your organizations have been impacted by COVID-19 and the steps that you're taking. With CMHC, I've seen the resources you have around, I can't pay my mortgage and what are my options, the Canada Emergency Commercial Rent Assistance Program. So Shai, maybe just to speak about how it's impacted your organization.
Yeah, I'd like to start off by saying, so we already worked in a results-only work environment. So our employees are able to work where they want and when they want. So our company was already equipped and we already had the IT infrastructure that I think a lot of people struggled with to get everybody up and running, working from home. So for us, that was pretty smooth. However, the crisis affected a lot of our priorities and the way we support Canadians. So kind of as Charles just mentioned, we kind of had to really quickly and swiftly shift gears as part of the federal team to support Canadians and the economy. So, you know, as Charles mentioned, providing relief for housing, supporting the liquidity of financial markets, ensuring that banks and mortgage lenders are not proceeding with foreclosures, making sure people have a roof over their head during this time, and also promoting the suspension of tenant evictions. So we've had to stand up a significant number of programs in a really, really short period of time.
Thank you, Shai. And Mario, maybe you can speak a little bit about, you know, how I said Innovation Science Economic Development Canada is helping with, you know, self-employed professionals, managing your business and reimagining maybe businesses in new markets that are developing.
Exactly, you got it. You know, as we listen to the news every night and we hear that small and medium-sized enterprise are getting support from the government of Canada, and you see a lot of the announcements made by the Prime Minister, one of the departments that is behind the economy is my department. So as you can imagine, the pressures, you know, that senior management and senior officials and every single employee in the department are working like day in, day out in making sure that the economy is still running. And a lot of questions right now that we hear from people is, what is it gonna happen in the future? Are we gonna get back to normal? Is the economy gonna get back to normal? And all we can say is that we support it the best as we can. And I'm very amazed by the quality of what I've seen so far. Like, the government has turned around really quickly in order to be able to support the economy. And when I look at the employees at my department, we're about 6,300 employees from coast to coast. And some of the discussions that we've had with senior management over the last couple of weeks or even months since I started my position as Ombudsman is our capacity to be agile, equipped, and inclusive, which are pretty much buzzwords that are being used by PCO, the Privy Council Office. And what I've seen so far is, yes, our department has been very agile. Like, all the, you know, to SHAIROZ's point, all of the technology is available. I think the challenge for us in the department was more of a culture change, where, you know, some managers might have been more uncomfortable in managing people from distance. Now we are seeing a reality. We are right into reality right now. And what I've seen is, I'll be able to speak a little bit more about this later, but what I've seen is people are getting slowly adapted to using these new technologies, and managers are getting more and more used to managing their employees from distance. But all that being said, I would say as Ombudsman, I've seen the volume of clients more than doubling coming to me. So the distress is there, and the feeling of isolation is obviously one of the main barriers right now for people to be able to, you know, being comfortable in working remotely. So that would be the gist of it. There's obviously a lot more. I'll be speaking to it.
Thank you, Mario. And for you, Bill, I reflect, we had one of the last in-person meetings with the conference board in March. And immediately, Bill, you said, you know, let's get a daily video out. And you've been doing that for, you know, since the beginning. So, you know, I'm just reflecting on that experience, Bill.
Yeah, I think the purpose is, like, I've been a little bit older than some people doing this. I've been in mental health for about 30 years. And one of the things, you know, I've spent a lot of time in the crisis intervention world. So I was there for World Trade. I was there for Swiss Air. I've been doing crisis intervention, suicide, all the things that people don't want to talk about for a long time, forensic psychology. And I've never in my life experienced anything like I did now. Is because the whole country, every Canadian's under siege by something, and it's invisible. And what happens is called hedonic adaptation, is that we have a tendency to get actually used to things that are good in our life and used to things that are bad in our life. So for example, if you win $1 million within a year, someone that wins $1 million, they get kind of used to that, and they They go back, slip back to their old set point. When we have what's going on right now, my big concern, the reason I did this is because I know people's motor, whether they know it or not, there's a bit of adrenaline and people are running. So we're almost like we're talking about it with our good friend. We're almost like are in theater right now, like if you're in a war. Because basically, if you make a mistake at this point in time, if you don't have the antibodies, by the way, we don't know if that works yet because of the World Health Organization where we're at, people have that anticipatory anxiety. Some people will stuff it, and some people are going to have what is called hypervigilance. So the reason I did this is because I want to start to normalize the conversation, the experience around mental health, is because what happens is many people don't have a frame of reference. Like bad things happen in other parts of the world. We have situational crises, we have floods, and we have a tornado here and there. We might actually have some, seismic activity on the West Coast. We'll have, a spill here or there. But a pandemic and understanding what the impact is, my concern is, and the reason I'm doing it too, Charles, is to get people talking because stigma is a big issue. Mm-hmm. And lots of people, and I'll say this to start moving on, Charles, is that lots of us actually start putting, you think about physical health, lots of us will start to put body weight on and we won't pay attention. And we get used to that. And we go 5 pounds and 10 pounds and 15. The challenge with stress that's happening right now is accumulating. And people that aren't used to it are accumulating. Now we're going to have lots of folks. So, one chap earlier was talking about addictive disorders, and I could relate to that. I did my postdoc at UCLA in addictive disorders, and I can relate to that challenge, and I can relate to the obesity. And I can relate to that because people are trying to cope. But ultimately, what I'm hoping we'll be able to do in this conversation is be able to demystify and provide some hope for people that the great thing about human beings, is that I've been around folks, I was at World Trade and different things. We have an amazing amount of resiliency. There is, and the amount of us to be able to bounce back. What we need to do is give people a frame of reference to interpolate what's happening to them so they can actually normalize. The reality is it's not going to be normal for the next near future. And I don't want to hear post-COVID, we got to stop that. I'm hearing people do that. Until they have an antibody, till they have a viral, that's post. We're going to go now back to what's called return to workplace. We need to be mindful that if we screw this up, the amount of energy that's gone into people to get to this point, and the amount of capital we've burned, if we don't pay attention to this, because the real wave is going to be mental health, and that's going to be the big impact of this situation is going to be January, February, March. It's not now. It's going to be down the road. Fatigue's going to be hitting people soon.
Awesome. Thanks, everybody. Thanks, Bill. Brought the big guns out early on. It's so great. There's so many great ideas. I want to reflect on how your lived experience has prepared you for this. So you're all health, well-being, and mental health leaders. How have you drawn on your experiences to take on this challenge?
You go first. I'm nice.
I'll
I
be
have a hard time being
SHAIROZ first.
Sure. I'm happy to go first. I think for me, being a parent has really kind of helped me. Something that I learned really early on with a young kid is, you don't have to be perfect all the time. You don't have to always have all of the answers. You don't have to cook those perfect meals and have those great schedules and all those activities. All you need to do is make sure that your child feels loved and safe. And, through this crisis, that's taught me a lot, that in our workplaces, in supporting our people leaders, and even at home, making sure that, the people that we work with, the people that we support, and our families and our children, they feel safe and they feel loved. I think that goes a long way in supporting people's mental health and helping each other get through the crisis.
Yeah.
Awesome.
Mario, or you or I? Age before beauty? What are we doing here?
Yeah, so for me, it's been a big difference. I'm now working from my cottage. I came here for skiing back on March 13th in Mont Tremblant, and actually I've been here since then, not even being able to get back home in Gatineau. So working remotely now, I think I'm getting there. I'm getting a little bit like an expert. I feel like I'm an expert. I'm getting there. I would say that I've been listening to a lot of videos, including videos from Bill, because he's giving like fantastic advice on how to take care of yourself. And since I've been watching these videos, I can tell you, every morning I have this walk of 45 minutes. My wife asked me for another walk during lunchtime, and in the evening, another walk. So I've never walked as much as before, any time before in my life. So thanks, Bill, for that good advice on your videos. I'm taking good care of myself. But I think what has changed for me is, how can I capture the distress of people as part of my ombudsman's role? And that is not so easy. I find that the best way to do that so far has been to do active listening to any people that are reaching out to me, and not jumping too quickly and giving options or advice. Or what I've noticed, the advice is so much available everywhere on the web. It's amazing. There's no lack of advice. I think where there might be a lack, it might be in the active listening, being able to listen to people and provide them with that safe space where they can express what they're going through right now. And if it's only that 1 hour or 1 hour and a half that you spend with them, I think it has a lot of value. That's what I've noticed on my side.
Yeah, and thanks very much, Mario, for those kind words. For me, I think I'm a little bit different than some people in this conversation. As I said, I've been doing this for 30 years. I've seen patients for 30 years. One of my PhDs in counseling psych, my other one's in IO psych, and I'm working in and out of organizations. But I'm a person who's been traumatized myself, and I've been a person who lived my entire life with a mental illness. And one of the things is, when you actually have your world disrupted and actually catastrophized, and I lived in 12 years of pure fear. And when you have those experiences, you draw back into your memory banks, not savoring the negative, but savoring that I have a lot of empathy, understanding that when people actually have a difference between what they want and what they have, we need to be careful to project our expectations in other human beings. If you're doing really, really well, good for you. Some people may not be. And so one of the things about us is having more tolerance and patience. If anything just come out of this conversation with COVID-19, I'm hoping, is that I've been hammering at this for years, that mental health and mental illness are two different phenomena. And most organizations have tried to do something around mental illness by having EAP, which is important. Train their managers what to do around duty inquire. Do some little things, maybe throw in the random resiliency course for shits and giggles, and then that's my mental health strategy. And what we have to understand is that human beings, very much like occupational health and safety, mental health is an infinite resource. No, it's a finite resource, and human beings will vacillate back and forth. So I'm hoping, Mario, that this conversation is that it actually might be reducing some of the stigma and actually helping people actually understand that we are actually fragile. I'll give you a quick example. My just cause in 2020, I was talking to a really dear friend in Vancouver, Charles, out speaking, and someone came up to me. We were having this conversation, and this is one of these things where, you know, when you're ready, the teacher shows up. And I'm sitting there, I wrote a book on a relationship survival guide. I've spent years doing marriage counseling and all that kind of stuff. And all of a sudden somebody said to me, said, Bill, what do you think about this thing called loneliness and isolation? This is back in October. Mm-hmm. And I go, let me think about it. I wrote something, I looked and I had something on it. I go, do you know what? They go, what? We're actually, the DSM-5 doesn't have isolation and loneliness, either does the ICD-9. And what I realized that what the real issue is, we're saying it wrong. It's the absence of social connections. And so what happens is that I realized when you go to Tim Hortons and you see Jackie, hey, Jack, how you doing? You check in and you go see the guard, and you have these little micro touches every day that actually give us connectivity. And then when you create this massive disruption, the people that perhaps their job and their people are the most significant emotional connections they have each day, what's happening, we're using the word loneliness and isolation, we're actually confusing it. Isolation is barriers. Loneliness is the affect. So the barrier right now is objective barriers called COVID-19. You're stuck in your house if you want to stay alive and actually not hurt other people and do your job. The loneliness is but the antidote to this is social connections. And that's what I started in January when with the Globe and Mail. We have a survey. And one of the things I'd like to do, Charles, is get that out to people on this, is that they can have a survey to evaluate the perceived isolation load, the loneliness, to have a frame of reference to understand they're different and to be aware that there's the algorithm for mental health is physical health, mental fitness, and social connections. And people like me need to do a better job in reminding employers to focus on social connections. And that's where I feel I need to do a better job. I got to get that out and talk about that more, is because there's probably nothing you can do more to help someone's psychology than have a safe, authentic connection where you feel valued when you're around them. That's important.
Yes, I very much like this, what
great.
you just said, Bill. If I can just give an example of social connection. Not so long ago, I was asked to do not a panel discussion, it was more of a town hall with a group of, I think, about 75 people. And it was interesting to see that this town hall was managed in a way that it almost felt that you were present, you were there. As part of the programming, there was the awards of recognition for mental health in the workplace. And I thought this is interesting because you are giving an award for mental health using like technology, and everybody could see each other like through MS Teams. And I thought this is good practice. So I sent an email to the senior director just to say congratulations, because you are keeping that social connection, even using technology. And I think from my side, I've been trying to keep that connection with my own team. Every Monday we have our staff meeting, and during the week, if there's a bilat, we try to keep that connection going. It's so important. And I've seen a difference in the team, like they feel engaged, they feel they understand the direction. So the feeling of isolation is obviously there, like they're feeling alone. But through that technology, I think we can keep that human connection as much as we can.
I love that, Mario and Shai. I think it must resonate with you too, and the work that you're doing and the storytelling that's emerging out of CMHC.
Yeah, so we constantly say that these concepts, all the things that Bill is saying, they're not HR initiatives. They have to kind of permeate the fabric of the company. And so for us, we've had excellent support from our CEO and our senior leaderships. For example, talking about, you know, their vulnerabilities, how they're coping in this situation, how it's okay not to be okay. I think consistently, our CEO has started every message through this crisis by saying, we don't expect you to work at 100%. We expect you to look after yourself and your loved ones as your #1 priority. Work comes next. Giving examples of how, you know, they're coping with kids at home, interruptions on, you know, important calls and things like that. And showing, and being vulnerable and being authentic through this, I think builds that trust, builds that safety, so that when employees are not feeling at their best, they will take those opportunities to reach out to each other and to their leaders for guidance and support. It speaks to how we're bridging the gap with those social connections, but also creating a safe work environment for folks during this very difficult time. I would also offer that being able to work, I think, during this time is a privilege. It gives us some focus, something meaningful to do sometimes, and it makes us feel like we're contributing to the greater good. I know that one of the things that CMHC started a couple of weeks ago is people are looking for ways to help. People are looking to say, how can I volunteer with my community? What can I do to support other people?
Exactly.
So what we're doing is we're actually inviting people to share their stories. We had somebody share, so we, you know, like performance pay, you know, people get that. Well, somebody thought to themselves, hey, I'm in a position of privilege, and shared anonymously, they're sharing their bonus with the food bank, because there are so many people that are not able to feed their families during this crisis. We have a Zumba instructor on staff, and so she's offering free classes a couple days a week to everybody. And you can see the kids and the spouses and the whole family participating. And also, to Bill's point about mental health and making sure that those connections are there, we're actually doing mindfulness sessions a couple days a week, encouraging people not to overwork and try to over-contribute, to make sure that people are taking time for themselves, as Mario's doing with all his walks. We're taking time, we're trying to encourage employees to also pause. We're not expecting people to run at full speed, looking after their families and loved ones, run at full speed on a work platform. This is a marathon, it's not a sprint. And so we need to make sure that we're taking those pauses and times to recharge. So I think as a company, we're trying to make that a priority for our employees as well.
Thank you. Great insights. I just want to pick up on a few things that emerged. I think, Mario, earlier you talked about your no wrong door policy. And in so many conversations, you just say, okay, no, that's an EAP conversation. Whereas you're taking the time, no, you went to, this isn't, my expertise is not as a clinician, but I want to talk to you. So you're not just automatically pushing them away. And then, I think Bill with Katrina from Shopify too talked about school wasn't for me. She was diagnosed with dyslexia, and then talked about that growth mindset. And I think there's resonates with a lot that you, from your lived experience. And one of the questions was around your videos, Bill, and those are available on the Conference Board website. So I'm happy to get those out. We'd like to pivot. I know we have about 10 minutes left. We've had a lot of great insights for a quick lightning round, and you've touched on a whole bunch. In this moment, to help all the folks on the line, quickly, one thing you think that they should focus on. And you may have already touched on it, maybe just reiterate that, and then we're going to move to the next session.
I'm happy to go, and then you guys can jump in. I was actually asked this question this morning by an organization that accessed about 1.2 million people, fairly substantial organization. And they called me this morning and said, Bill, we want to do one thing. What is it? And I said, it's not a program. It's not a policy. It's to provide the opportunity for facilitate a two-way accountability, where basically what you do is you encourage every employee in the organization to develop their own personalized mental fitness plan. Provide them with a frame of reference of what the heck a mental fitness plan is, and not expect that everyone needs to do the same thing. So for example, under the physical health pillar, let people realize that the mind, body, make sure they understand exercise, diet, rest, nutrition, lifestyle, make sure they understand that serotonin is not made in your head, it's made in your gut. So what you put in your mouth is going to make some difference. Educate them on that. Then let them make a plan. With mental fitness, like I've written in the Globe and Mail, we can give it, I have over 300 micro skills. Yes, meditation something, mindfulness something, deep breathing. If you're anxious, you need to work on your amygdala part of your brain. You need to learn how to do deep breathing. If you're running your brain forward, you need to know how to deconstruct your thinking. So you might need different cognitive reframing. Get techniques that help you to do mental fitness. Very much like a Stairmaster. If I want to get ripped, I got to do something with intention. It takes 8 to 10 minutes to 12 to work on your mental fitness. The last thing is social connections. Someone asked a question and I want to make sure I answer it around micro-touching. The micro-touching part of it's really important. In the absence of micro-touching, you'll need to, with intention, start to do that. So for example, go back to your old high school, university, college, friends, and start calling people you haven't interacted with in a while, provided that you feel comfortable enough to self-advocate to reach out. Many people right now, I'm getting calls from people I haven't even talked to, like, I can't even tell you how long, out of the blues. Hey, Bill, how you doing? I'm going, this is, and they remind me sometimes who they are because I can't remember. Then I go, oh, geez. And all of a sudden I get a good feeling, they get a good feeling. So in long and short of it, Charles, if I was to have power, I'd have every CEO help every employee design their own mental fitness so they can learn to charge the battery, because there's things the employer can do that can charge it and stop from draining and vice versa. That's what I would do.
Awesome. Thanks, Bill. Shai, Mario?
I would say, you know, for me, we need to continue to be agile. I think there are a lot of unknowns as we move through this crisis. As a company, we want to encourage our leaders and our employees to be as agile as possible. The way, to me, something that really hits home is how the silos have been broken down and how people are coming together from all parts of our company to work together. To me, this is something to take forward as we move through this crisis. So I think also recognizing that people are going to move through this crisis in different ways, and recognizing that there is not a one-size-fits-all solution. And so again, that agility comes into play, making sure that we're constantly taking the pulse of our organization to see where people are at and adjusting what we're putting out to support employees. I think regular, timely communication, regular supports to employees. I mean, we've instituted almost bi-weekly calls with the leadership. We've you know, open door policy. People are writing to our CEO. He's responding. So, you know, we're making sure that we're constantly, that dialogue is open, that we're being as flexible and agile as possible to support different needs, and to make sure that people know, again, kind of to Mario's point, there is no wrong door to knock on.
Yeah.
There's always somebody who's going to respond if you reach out. I think that's
Awesome.
Cool.
Hey, and Mario, quick last word here on this topic.
Thank you. I think we need to humanize the workplace, humanize the public service. I like to say to people every time I speak that we're not managing files, we're managing people. And when I say managing people, I don't mean it in the bad way. We're managing relationships. And in my dream, I would like that first meeting, once we're all back into the workplace, to be about the human sides of things and not about the work. I would say to all of our listeners today to take the time, build a list as to what they would want to discuss in that first meeting back to work, and not talk about the work files and the workload and the stress and all the things that we haven't done. It's not about that. It's all about building that solid working relationship. Because I can say as Ombudsman, I'm a little bit concerned about the return to work. What is this gonna mean? And I know I've done a Q&A with Bill, and I was very interested in seeing your response back. I think every workplace right now should evaluate the impact of people returning to work and have at least have a plan in their mind. How is this gonna happen? How people are gonna interact with each other in the future. I think it is so important, so important.
For sure. So, and it resonates with Michael talking about the passion speakers, is start with the end in mind as well. So thank you, Mario, and you'll see Mario and Bill, that'll be out next week, Mario, that Q&A that you had with Bill?
Yes.
Okay, so stay tuned for that, everybody. Rob, do you mind launching the poll that we created? The second one? We skipped the first one.
Yeah, sounds good. I can do that. It should.
So,
now.
Okay, so everybody, we'd like to ask you the impact you see as when you return to the workplace. Will you have no change? Will you be cautious or hesitant about the spread? Will you be strained or concerned about the future? Or do you, are you going to be significantly impacted? Like, have you experienced the loss of a loved one or a traumatic exposure? So we'll let that run for a minute. And I'd like to start with Shai and Mario. For your organizations, what do you think is where do you think your organization will fall? Where will most people come back? Maybe start with you, Shai.
So I think there's going to be employees in all the categories.
Yeah.
And I think that's going to be key, is recognizing the fact that there's not going to be a one size fits all. And it's important that we have supports in place geared for the people that will fall in all those categories. I think it's
not just like a one size fits all.
Yeah.
Yeah.
We gotta, everybody's gonna emerge from this crisis differently in their own time, in their own way. We kind of all got thrown in it, almost all at the same time. But how we come out of it is going to be dependent on our own circumstances and our own personal situations. And so we need to be flexible and supportive and recognize that it's going to be different for everybody.
Awesome. Mario, how about, what are your thoughts? Same idea, or do you think one will stand out over the others?
Yeah, now that I see the answers, it can be a little bit painted, but I agree with Shai. It's probably all of these answers are valid. It's really hard to evaluate how people feel right now, but I would say it's how we respond to all of these different mental health conditions that will make the success in the workplace. And actually, I'm looking at these answers right now, and it reminds me that we launched a survey to all of our employees as of yesterday. And this will help the organization in capturing what are the top 3 or 4 issues that are causing stress right now. So I think as an employer, when we talked about being agile, we need to capture what it is that is affecting employees right now. And so I kind of like these questions. I'll take good notes of them.
Okay, thank you, Mario. Bill, I'd like to ask you just on that cautious of the spread, one thing you'd recommend to folks, because that seems to be the highest percentage. So in 1 minute, what would you recommend?
What if I don't want to?
Now it's 50 seconds.
No, I think the big one on that one is that cautious people need to know what the rules are going to be, what the expectations are, and how, from a restorative justice perspective, if someone wrongs someone and creates a mental harm, you need to understand if you violate my 6 feet. For example, Ford has bracelets now in the factory that people come within 6 feet, they vibrate to help people become unconsciously aware of boundaries. We need to be aware that some people are going to be more hyper vigilant than others, and we need to respect that some people are going to have more anxiety. And it doesn't mean that they're trying to be weak mentally or whiny or etc. We need to ensure we're not doing harm. That's about psychological safety, is not doing harm to other people. So have those conversations with people about what this means and be able to fix things so that you can realize this is about learning, not being about punitive. Teach people how to feel safe, the wrongdoers, the right doers, because everybody at the end of the day wants to be safe. That's at the end of the day. So just keep that to universal.
Awesome. Thanks, Bill. As we close this down, I don't see any questions in the chat box, but Rob, if there's questions, we could stay on for a few minutes. Just in closing, Shai, Mario, Bill, this is an energizing conversation. It's kind of a Super Bowl for someone in their sweatpants almost every day. It's a lot of fun to do this with you all. So thank you. Thank you, Rob and team, for organizing this. We are launching a survey with the Mental Health Commission of Canada to tackle just this. And this will be released likely tomorrow or Thursday. So stay tuned for that. Rob will send that in the link. So Rob, is there any, or maybe you have questions you'd like to ask the panel before we close it down?
Yeah, there's no questions that are popping up in the Q&A. I'm just looking at the chat now. It looks like a lot of just validation in terms of a lot of the comments and great ideas that came from this. But I'm not seeing anything pop up from that perspective. Yeah, and I also want to be sensitive to people's time. It's 2:30, but nothing's on the Q&A at the moment.
Okay. Yeah. So yeah, I guess thanks, Rob. This was fantastic. Thanks for having us. Thanks, everybody.
Bye-bye.
Thank you.
Take care.
Yeah. Great. Well, thank you so much to the panel. I really appreciate the time and effort being involved. Last things I just wanted to mention before we take off today is that first thing I just wanted to thank a number of you. First off, the speakers donating your time. I know everyone's really busy, and even beyond busy at this moment. Just donating your time for that. Also to the Work Tango and HR Gazette team, putting on these events and promoting it and finding speakers takes a lot of effort. And also all of you as well. Your attendance, your level of just attention and just communication through the chat, just being involved and engaged was something that we really wanted at the end of the day. So, you know, this is the first time we've done a virtual event. We're figuring it out. We're doing 3 more between the 13th, May 26th, and June 10th. You can see the dates there.